Hello, my name is Stephen Falconberry, and I will be reviewing the contents of the Belmont Report. In 1974, the U.S. government passed the National Research Act. This legislation was developed in response to abuses of human subjects in research that had occurred over the past few decades. Specifically, the Nazi experiments on concentration camp prisoners and the Tuskegee syphilis study were two egregious examples of researchers abusing their subjects in the name of quote-unquote scientific advancement. This legislation established the National Commission for the Protection of Human Subjects in Biomedical and Behavioral Research. This commission was created to identify basic ethical principles in biomedical and behavioral research and to develop guidelines to help researchers comply with those principles. To achieve these goals, the Commission held a conference over 4 days in February 1976 at the Belmont Conference Center and created a set of guidelines for the U.S. government to use to enforce ethical research. The Belmont Report is a summary of the conclusions made at these deliberations. In the Belmont Report, the three main topics that were deliberated on at the conference are covered in depth. The first topic was to define the terms practice and research in the context of biomedical and behavioral research. The second topic was the three basic ethical principles that were developed, namely respect for persons, beneficence, and justice. The third topic was the standard research requirements that were developed based on those three basic ethical principles: informed consent, risk-benefit analysis, and subject selection. This report was submitted as a statement of the Department of Health, Education, and Welfare's policy on human subjects research. As stated earlier, the first topic covered in the Belmont Report is the difference between practice and research in the context of biomedical and behavioral research. The term practice was defined as a treatment or therapy that is designed solely to enhance well-being, has a reasonable expectation that it will work, and is meant to treat an ailment. Conversely, research was defined as a treatment or therapy that is designed to test a hypothesis and adds to scientific knowledge. An example of a treatment that is considered practice would be inserting a stent to open up an artery, whereas an example of research would be testing an implant for its bioinertness. These two terms are not mutually exclusive, as something can be both practice and research. For example, if one were to be testing the efficacy of chemotherapy as a cancer therapy, it could be considered practice in that chemotherapy is designed solely to enhance the well-being of the patient. It's meant to treat the ailment, cancer in this case, and there's a reasonable expectation that it will work. However, it could also be considered research in that you are testing the hypothesis that chemotherapy is an effective cancer treatment, and the conclusion of this study would be a benefit to scientific knowledge. Because the Belmont Report focuses on ethics, it highlights the fact that any treatment or therapy that can be defined as research is required to be reviewed in order to determine whether there is a need to protect the human subjects because of the uncertainty of the treatments that are being administered. The second main topic covered in the Belmont Report is the three basic ethical principles that were developed at the 4-day conference. The first principle, respect for persons, states that subjects should be treated as autonomous agents capable of making decisions about whether or not they wish to undergo treatment or therapy. In the case that a subject is not fully autonomous and incapable of making the decision for themselves, this principle states that they have the right to be advocated for and protected. In short, the respect for persons principle requires a subject's consent before any treatment can be administered. The second principle, beneficence, requires that researchers attempt to maximize benefits of their research while minimizing the potential harms to the subjects that are participating. With that being said, because there is no way to eliminate all risk from any treatment or therapy, and the extent of the benefits is often unknown before the research is done, researchers must balance between the needs of the many, or the benefits that this treatment or therapy could provide, and the needs of the few, or the risks that the subjects that are participating in this study undergo. This means that in order to comply with the principle of beneficence, research must have the risks massively outweighed by the benefits provided by this treatment or therapy. The third principle, justice, states that all subjects should be treated as equally as possible. This means that in the development of research methods, there should be a fair distribution of both benefits and risks. So no subjects have to bear an undue burden of the risks or get an unfair amount of the benefits. Additionally, this principle states that subject selection should never be discriminatory. As seen in some of the most horrific human subject abuses, such as the Tuskegee syphilis study and the Nazi experiments on concentration camp prisoners, researchers would often prey upon subjects from groups that could not make informed decisions on whether or not they wanted to participate in these studies. In the case of the Tuskegee syphilis study, poor minority groups were often preyed upon, and their socioeconomic status was used as leverage to manipulate them into agreeing to the study. And in the Nazi experiments of concentration camp prisoners, the prisoners had no say whatsoever in whether they participated or not. The ethical principle of justice states that coercion and manipulation of subjects is absolutely not allowed in an ethical research study. Additionally, any publicly funded research study should be beneficial to anyone who has paid into the public funding of that research. So, research studies that are publicly funded cannot have the same sort of privatization as a private study does. From those three basic ethical principles, the Belmont report developed a standard set of research requirements that any ethical research study needs to abide by. The first of these standard research requirements is informed consent. As stated when talking about the respect for persons ethical principle, subjects should have the right to be able to decide whether or not they want to undergo the treatment or therapy being prescribed by the research study. However, just merely saying yes does not meet the requirement of informed consent. In order to avoid coercion or manipulation of the subject into participating against their best interests, the Belmont report includes three main guidelines that are required in order to have a decision by the subject be considered informed consent. The first is that the subject should have access to information about the research, including the methodology and what exactly researchers expect to happen to them. The second is that the subject should comprehend the information given to them. If the subject is unclear on any of the information that was provided, it is on the researchers to explain it to the best of their ability to help the subject understand what exactly they will be undertaking by being a participant in this study. Third, the subjects must volunteer to take part in the research. They cannot be forced into doing so, and if they are coerced or manipulated into doing so, this is also not considered informed consent. They must conscientiously volunteer for this study. The second research requirement is to make a risk-benefit analysis. As stated in the ethical principle beneficence, the benefits of what this research may provide for people must be weighed against the risks that will be undertaken by the subjects. Specifically, the researchers constructing the study should weigh the risks to their subjects against the benefits of their research being concluded, but also the participants should each do their own risk-benefit analysis on what they should be risking versus what benefit they will be getting out of this participation. This decision-making process, specifically in terms of the participant, should be included as part of their informed consent. In order to perform the risk-benefit analysis, the probability and magnitude of the possible harms should be compared to the probability and magnitude of the possible benefits. This means that not only should it be considered how bad the harms are or how good the benefits are, but also how likely they are to occur. If it is the case that there is a chance that a subject could possibly die, in other words, a high magnitude of harm, but the probability is very, very, very small, it still could be possible that the benefits outweigh it. However, if this probability goes up and the magnitude is still high, then an even greater benefit would be necessary in order to outweigh this potential harm. Overall, the risk-benefit analysis should conclude that the benefits outweigh the harms in order for the research to continue. The third standard research requirement relates to subject selection. As stated in the ethical principle justice, subject selection should be fair and non-discriminatory. This justice should be on two fronts. First, individual justice. Individual justice means that the benefits and risks should not be spread based on favoritism. In other words, an individual subject should not have worse risks and less benefits, or more benefits and less risks, based on any sort of desirability factor for the researchers. The second aspect of justice and subject selection should be social justice. In this case, it's required that a distinction be made between certain groups to create an order of preference based on the ability of the group to bear the burden of the potential risks. Namely, if a certain group is more enfranchised and better able to bear the burdens, they should be selected for the higher risk research. In other words, all things being equal, adults have a better opportunity to bear the risks and burdens of a potential research subject rather than children. Additionally, certain groups may only be appropriate to select for certain cases. For example, prisoners might be an all-right option in certain cases, but if there's any coercion or manipulation included, it would not be appropriate to select prisoners because they have less of a defense against manipulation or coercion. Overall, when selecting subjects, researchers should attempt to be as equitable as possible and choose patients without any subjectivity in which patient gets which burden or benefit. However, in certain cases, certain groups may not be appropriate to use as subjects for certain risks or benefits based on their innate socioeconomic, racial, sexual orientation, or other aspects of their personality or being. So, in summary, the Belmont report created initial guidelines to address human subjects abuses that had occurred in the past. These guidelines included requirements of ethical research based on a few basic ethical principles, namely informed consent based on the respect of persons, risk-benefit analysis based on beneficence, and subject selection based on justice. These requirements are the basis of current U.S. research ethics in the biomedical and behavioral fields and they, to this day, guide research studies throughout the country and world.